gentlemen. Thank you, Justin, for the very warm welcome. On behalf of the World Health Organization, I'd like to thank the International Life-Saving Federation, Life-Saving South Africa, and really all of the members of the National Life-Saving Societies for the tireless work that is done on life-saving around the world. Beyond your work on life-saving, you are providing an invaluable service by supporting a world conference that allows the entire drowning prevention community to come together. On September 11th, 2001, hijackers flew 4 planes into buildings and ground, and they killed just under 3,000 people. And the reverberations from those acts continue to rock the world to this day. However, over the time that this conference will run, a roughly equivalent number of people will lose their lives to drowning. Most of them will be young, and most of them will live in low and middle income countries. The fact that this conference has attracted so many people from all corners of the world to come together here in Durban is a testament to the size of the problem that we are confronting and the conviction of all of us here to prevent drowning. Now, I think the size of this conference is one thing, but I also think that the broader reality is that the recognition and awareness of drowning as an important global challenge is growing. There are more governments prepared to engage with this issue. There are more donors prepared to support drowning prevention program. And there are more and increasingly qualified people coming in and contributing to this field. One needs only to reflect on the breadth of themes that our conference will address to appreciate how this field has grown. And I want to take a minute to talk about this conference program because I find it very exciting. Over the coming days, we will hear about global and regional campaigns to increase stakeholder awareness and promote multi-sectoral approaches. There will be extensive focus given to policy development. We will hear about new and innovative approaches to make transport on water and boating safer. A number of important sessions will address the role that disaster risk reduction can play in preventing drowning and the need for the drowning prevention field to more firmly anchor itself within disaster risk reduction and climate change efforts. We will hear a great deal about new data and new data collection methods, particularly concerning non-fatal drowning. There are a great many presentations that will be made concerning intervention studies. The Sustainable Development Goals, which is the framework that is driving global policy around development assistance out until 2030, will be a central focus of this conference. And I'm very pleased and quite excited to have the opportunity over the coming days to learn much more about the drowning prevention situation in many African countries. So I'd once again like to thank and congratulate the International Life-Saving Federation and Life-Saving South Africa for really putting together such a rich and exciting program for this conference. I'm going to focus most of my remarks around why our field is growing in size and importance, and I'll concentrate on progress in 3 areas. I'll close my remarks by giving some thoughts about what I see as 3 key challenges for the field ahead. So firstly, in terms of explaining our progress, we are mobilizing a wider range of actors to engage with this issue. And within this group, we are coalescing around sending consistent and coherent messages. So just, if you look around you, you will see that we are lifeguards, we are academics, representatives of government, civil society activists. We are doctors and nurses. We are people whose lives have been impacted by the tragedy of drowning. We are donors who can make things happen, and we're members of the United Nations agencies. And this diversity brings with it the potential to be a strong force for moving drowning prevention forward, but only if we can fully leverage our different perspectives and interests and ensure we are sending out consistent and coherent messages. And I think to a large degree, over the last 8 or 9 years, we have by and large succeeded with that. One essential message that has gone out and has been heard is that drowning is a preventable cause of death that is vastly neglected relative to its global public health impact. We've made sure that others understand that drowning kills more people every year than maternal conditions, and almost as many people who die of malnutrition. We make sure that people understand that even with what I've just said, that our estimate of global drowning is just an estimate, and a conservative one at that. As it's been mentioned earlier this morning, our estimate of drowning doesn't take account of flood-related drowning deaths, intentional drowning deaths, or drowning arising from water transport. We make sure people understand that drowning is a leading killer of children and young people in every region of the world. So those are the facts, and as we have presented those simple messages in a consistent, unified way, recognition of our issue has grown. Secondly, we are framing our issue in a way that resonates with external audiences. So it's been almost 30 years now that I've been involved in global health. And in all that time, I cannot think of a single issue that has achieved global prominence while being anchored within a single community. Part of what drives issues forward is making them a shared concern within a wider range of actors and integrating issues within other agendas. If you remember, for those of you who were in Vancouver, we heard during the conference plenary a very personal perspective on drowning among refugees in the Mediterranean. We heard that Médecins Sans Frontières had moved into a very non-traditional area for them simply because of the humanitarian imperative. That recognition by MSF of the need to respond to refugee drowning is important. And the global attention directed towards events in the Mediterranean has reinforced to a global audience the importance of seaworthy vessels, competent operators, life jackets, weather advisories, and respect for the water. We have also collectively highlighted the important intersections between drowning and climate change agenda, with drowning being the principal cause of death in flood disasters and the projection that flood disasters will increase in frequency and severity. Flood disasters are the only natural disaster specifically referred to within the Sustainable Development Goals. And as I mentioned earlier, the Sustainable Development Goals are an extraordinarily important framework that is driving decision-making about development assistance up until 2030. We have to continue to integrate drowning within that effort, and flood disasters is one important entry point. Another is the Sustainable Development Goal target for ending preventable deaths among children under 5 by 2030. It's simply not going to be possible to do that in many low and middle income countries without massively scaling up drowning prevention programs. We have to make that point abundantly clear within the Sustainable Development Goal implementation agenda. And that brings me to my third and final area that I think has been driving our area forward. We have made genuine progress in showing drowning can be prevented with cost-effective approaches in low-resource settings. I mentioned earlier that the drowning prevention movement has attracted a growing number of people. It's also attracted a wider and deeper set of competencies within those people. There is an enormous amount of technical exchange that has already taken place here and will continue this week, and continuing to broaden and deepen our understanding of what works, how it is best implemented, and how it can be sustained will be critical to ensuring continued growth in this field. The World Health Organization intends to continue to contribute, and over the next year, we will continue working on the development of guidelines and best practice standards for some key interventions. We expect to launch those at the World Conference on Injury Prevention and Safety Promotion in Adelaide in November 2020. We will continue to work on country-level programming, and we will continue to support countries to develop national plans for drowning prevention. We are supporting the International Maritime Organization, which has been requested by their member states to develop model regulations to improve the safety of domestic passenger ferry regulation. We are hoping to contribute to the first ever UN General Assembly resolution addressing drowning, and we intend on exploring new opportunities with other UN agencies in the areas of occupational safety and disaster risk reduction. I mentioned earlier that I would close my remarks giving some thoughts on things that I see as three key challenges facing the field. The first of these is our need for more peer-reviewed evidence. Any of you who are involved in implementing programs to prevent drowning should take the extra effort to ensure that your results are published in peer-reviewed journals. I recognize that this is not easy, but there are many people here who are connected with academia who can help with this, and a conference like this offers all of us the opportunity to meet, make connections, and take advantage of the collective expertise here in Durban. Doing so will move good program implementation into a solid contribution to the evidence base around drowning prevention with lifelong impact. The second challenge I'd like to mention is that we need more governments recognizing the issue of drowning prevention and committing to engage with it, either nationally or internationally. Any of you who have ongoing contact with governmental counterparts can help this by asking representatives of your governments or governments that you are in contact with to do more. You can lobby them to implement evidence-based drowning prevention programs. You can lobby them to develop a national drowning prevention strategy. You can lobby them to direct their missions to the United Nations in New York, to join the Friends of Drowning Ambassador Group calling for a General Assembly resolution on drowning. You can lobby them to lobby the World Health Organization to provide support to drowning prevention efforts in your country. Or you can lobby them to support other countries within your region that may have a higher drowning burden. Now, the third and final challenge that I see in front of the field is the need for continued and deepened cooperation within the drowning prevention community and cooperation of the drowning prevention community with other sectors. Now, this has already started, but it is a long-term goal, and it is one that all of us have to recognize and work towards achieving. And, you know, as I look out among you, I'm very optimistic that we will succeed. So thank you for your commitment, and feel proud about the work that you do. And I'd like to close on this theme of cooperation by quoting the wisdom of an African proverb. If you want to go fast, go alone. But if you want to go far, go together. Thank you very much.